Hello everyone and welcome to today's webinar, Developing the Workforce of the Future, how the NHS is working with colleges in Northwest London. Before we get started, I would like to go over a few items so you know how to participate in today's event. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address as many of them as possible during the Q&A session at the end of today's presentation. It is my pleasure to introduce your chairman, Michael Wood.
Good afternoon and thanks for joining this webinar. My name is Michael Wood. I work as Head of Health Economic Partnerships at the NHS Confederation, and I also work in the NHS London Workforce. It's my absolute pleasure to be kicking off today's webinar, which, as we've heard, is titled Developing the Workforce of the Future, How the NHS is Working with Colleges in Northwest London. So I'm just going to give a quick run through of how the next hour will pan out. I will set the scene with a national perspective, just reflecting on a report which I jointly published a few months ago, looking at how the NHS can work with colleges. Delighted to have colleagues from Northwest London joining, Sharon Probetz, Head of Learning at Imperial College Healthcare NHS Trust, and David Warren's Deputy Principal of West London College. So we'll hear a real place case study from Northwest London. We'll then have some colleagues from the Greater London Authority, the GLA, joining to give some context in relation to the skills agenda in London, and critically that link to economic development and recovery. And Faru Rahmani, Senior Manager for Strategy, Policy and Relationships, and Michael Henu, Principal Policy Officer, both come from the Skills and Employment part of the GLA. Last but no means least, we've got Mary Vine Morris, the London Director of the Association of Colleges, and Mary will chair the Q&A session. And just to repeat, please do keep your questions coming in, type them in throughout what we hear, and then that will help frame how the last session goes. So, I just wanted to say personally, and I think this reflects my experience in the past 12 months, the NHS college relationship is really one I'm particularly interested in. In September this year, I jointly published a national report with the Independent Commission on the College of the Future. And I think developing this report really highlighted two things for me in particular. One was that for such a critical part of the skills and employment pathway, often engagement with and knowledge of the college sector across the NHS was sometimes quite limited. The other bit was just this dawning sense as we worked on it, that I don't think we've yet scratched the surface of understanding what could be achieved locally by this closer working. This one slide here is an at-a-glance summary of the national report. The link is in the report. I think just reflecting on the opportunity speaks for itself really. The opportunity through better, closer working is there to meet our existing and our future workforce needs. But there's something critical about narrowing inequalities, and all the partners we spoke to in the NHS and in college sector all discussed health inequalities and just their role in that economic footprint. Something about the role of a coherent college sector in seizing the opportunity. So what we found were colleges were looking at how to work together and new partnerships they could make together. And what was particularly pleasing for me was the understanding that the NHS was almost a test case of how collaboration with an employer can work, and they will take the learning of that, I know, from working with us into different sectors. Some of the recommendations are just highlighted here. Just quickly, we really are striving to embed the role of colleges in the delivery of the NHS People Plan. I know there's national NHS interest in this now as well as local interest. We want to understand and help develop regional hubs which would bring together colleges involved in health and social care with the health and social care employers locally to understand strategically how to work and what we can do. And really interesting developments, we're calling for the creation of a new national voice for English colleges, the Health and Care College Council, perhaps along the lines of the Council of Deans in that terms of influencing nationally. Now, of course, having said all this, and through our work, good practice does exist. We found plenty of it. And it's fantastic to bring colleagues from North West London together. I know that the NHS has been working there with the 6 West London colleges for a number of years, the colleges that deliver health and social care vocational qualifications across a range of employment and skills programmes. I'm now going to hand over to Sharon and David to talk us through their work, and I really look forward to what they have to say.
Thank you, Michael. I'm Sharon Probetz. I'm the Head of Learning at Imperial NHS Trust, and we've been working with West London College intensively now for about 18 months and on and off before that. And I've got some slides to share with you that will take us through that journey, what the drivers were, and then David will talk a bit more about how that's worked in practice and what we're doing. And it's not just Imperial that's involved in this, it's all of the NHS trusts across the North West London patch. So I think with sessions like this, it's always helpful to remind ourselves the size of the sector. The NHS is this country's largest employer. I think we're still the 5th largest employer in the world, behind organisations like Walmart, the Red Army, and the American defence sector. But we do have issues. We have a lot of people, and I think through that, a lot of our workforce issues are just the turnover, managing that size of workforce and thinking how we can better engage and motivate those individuals. They're not just numbers, they're people providing a real meaningful service to our communities. And we're also faced with an increase in demand for healthcare services as the population in North West London in particular expands. So we know that our workforce is our biggest challenge. Vacancies average, they are much lower than they have been. I think that is a side effect of the pandemic, but on average we're looking somewhere between 10 to 15% vacancies. Turnover does tend to be quite high. It's higher in social care than it is within the NHS sector, but still 15% is quite high. We have a lot of vacancies every year, but they don't all happen at once. And that's been one of our challenges in working together with colleges, is to try to pace the flow of the vacancies so it made sense for delivery. One of our big challenges is that we are an ageing workforce, and there does seem to be quite a lot of resistance in bringing in younger people through apprenticeships, for example, or through Kickstart or T-levels and all of the other opportunities that are available. Just for my organisation, about 5 years ago, I did a survey of how many people under the age of 25 are in entry-level roles. So for us, in our banding, that would be people in band 2 and 3 roles. And I could count the number of young people in those roles on my hands. It was quite shocking. And 5 years on, it's a bit better, but it could be much better than it is. Added to that, we have a local college, West London, who have a large health and social care BTEC population, but only less than a third of those students are going into either higher education to pursue a healthcare profession, or are coming direct into a health or social care employer. And I really wanted to investigate what it was in the system that was turning those students off. Why had they spent 2 years on a BTEC course and then not pursue a career in health and social care? So part of what we've put together has been to start to address that. And I think our biggest challenge going forward is that, and I think the pandemic has accelerated this, there are new roles coming up. How are we going to reskill, retrain people who are already working with us, but also people who want to change career, who want to start a career with the NHS and social care? I think there are many more opportunities going forward. And we can use our apprenticeship levy as a large employer to help manage that. We already have some really great career pathways in place, and in many respects, the development of apprenticeship standards has made it much easier to lay out that pathway for people, not just how they could progress, but how they go about gaining the qualifications in order to make that possible. So right now, it's entirely possible for someone. Any of you out there might think, I'm desperate to be a healthcare support worker, or you may have someone in your family or a friend who wants a career change. They can join an organisation in health and social care as a healthcare support worker. Now, the illustrations I'm giving here are very much NHS focused. So they join as a support worker. No experience is necessary. We're much more interested in the behaviours and the values that an individual brings with them. We can train them in the skills that they need. The next step is to gain a foundation degree level qualification to move on as an assistant practitioner, to work much more autonomously, have a wider range of skills and underpinning knowledge to support how they work with patients. The step after that is to gain a degree and become a registered professional, nurse, therapist, scientist. And many people might choose to stop there, but there's more. So advanced practice, where people will work at the top of their license and are qualified to make decisions, to take history, to make treatment recommendations to their medical colleagues. And these people will have a master's degree and will work at a much more advanced level. So the pathway is there. I think our ongoing challenge is how we get that message out there and how we attract people who might not necessarily think that they can start a career in the NHS, perhaps because they don't already have a degree, or that they didn't do well with their maths and English, and that's a barrier for them. It really isn't. So I wanted to share this because I think it highlights even more how important the relationship between employer and college has become. So there are many routes into the NHS, which we know already, but look at how many of these require collaboration or some kind of working relationship with a local FE college or a local authority to support an employability programme, or to set up a T-level programme, or to help people return into practice. I was staggered how hard we have made that for people who are already qualified, and their only mistake has been to take time out to have a family quite often, and they want to get back in. But we make it so hard for them to get the work experience that's required. And then the new Kickstart programme. We're struggling to find new roles as opposed to vacant posts, but it's a fantastic opportunity. But again, it requires that partnership and collaboration with other organisations in the sector to make it work. So what I want to do now is to hand over to David to share with you how we put all of that into practice and where we are now. David.
Thank you, Sharon. Yes, and as Sharon mentioned, we've been working together now for nearly 2 years on this partnership, along with a lot of other NHS trusts and other care employers and GP surgeries, etc. And I just want to take you through the journey of how we got to where we are today. The first part of this was around identifying what was the problem that we're trying to solve, and I think Sharon's very clearly articulated what the challenges were, and that was really the starting point of this relationship, identifying what those challenges were and what we could do as a collaborative partnership to try and remove some of those barriers and try and solve some of those problems. So that was our first sort of step, really, identifying those challenges and those barriers. We then ensured that we had a collaborative partnership that was put together. So we engaged with all 6 of the West London colleges, got senior buy-in, and I think that was really critical for this to work, making sure we did get senior management level buy-in from all of those colleges, and then started to build the relationships with the employers using Sharon and colleagues at Health Education England and others to build those networks of NHS trusts, of GP surgeries, of acute practitioners, and the care sector as well. Once we had that in place, we then looked at what were the specific impacts that we wanted to have, how we were going to address those challenges really. And there were lots of things that we were looking at sector-based work academies, placements of work experience, T-levels, apprenticeships. These were all some of the challenges that the colleges themselves were dealing with, in addition to the challenges that the employers were bringing to the table that Sharon outlined earlier. So how did we work together? How did we actually collaborate and try to remove some of these barriers? So we set up an education group, and I chair that group, and it has representation on that group from the colleges and from the health and care sector. And it covers all of the 7 boroughs within West London. We have 6 colleges that are based within West London, covering again all of those 7 boroughs. And we have 10 NHS trusts, acute care, community care and mental health trusts represented as well. So that was the formation of the group itself, making sure we had full coverage across the region. Once we had established that, and that was established over 2 years ago now, we had then identified 4 specific work streams that we wanted to focus on, and each one of these addressed some of those challenges that Sharon mentioned at the top of the presentation. So one was around information advice and guidance and careers advice, particularly looking at that challenge where we knew we had between the 6 colleges nearly 1,000 learners that were graduating from BTEC health and social care programs. But as Karen mentioned, many of these then didn't go on to progress into higher education in that sector or jobs in that sector. So what was going wrong at the start? What was the information, advice and guidance being given to those young people from school into college? So we looked at things around careers and opportunities fairs and progression fairs, engaging with the employers, making sure that colleges and young people had that connectivity with the career pathways, understood the breadth of career pathways that were available in the sector, both in the health and the care sector, so that they made informed decisions and they knew what pathway they were on and where they were going in that direction, and keeping that constant connectivity with employers so that through periods of work experience and placements, they had that drip feed of interest in those careers, so that when they then got to the end of their course, they were much more motivated to go and progress into that sector, either at a higher level study or direct into work or apprenticeships. We also looked at the actual foundation of the structure of the courses themselves. What was it about the courses, and how could we structure them better to make sure that they had a more varied and interesting engagement with the sector during the course, rather than something that's just bolted on at the end. So Sharon and colleagues from West London College got together and redesigned and co-designed that curriculum, taking the core aspects of the BTEC Health and Social Care Diploma courses and looking at how can we tailor that for the needs of the West London businesses, how can we tailor that for the individual students, to give them a really rich and varied experience of the sector throughout their course. So again, looking at placements, work experience, and leading up to this was pre the launch of the T-levels, but now in the world of T-levels, looking at how we can integrate that with the extended placements that T-levels have. Third work stream was around sector-based work academies and programs specifically for adults that are unemployed and looking for work. That had a fairly slow start pre-COVID. We were working with the local job centres and DWP with mainly the long-term unemployed and those looking to transition into that sector. Since COVID, we've relaunched the programme and had a much greater interest, as you would expect. Lots more people looking to transition from sectors that are in decline, hospitality, aviation, etc., moving into health and care. So we've redesigned the programme to look more of transferable skills and how they can take skills from one sector and apply it to another. But the basic concept about the Career Clinic, which is the name we give to this programme, is that it gives people a taster of the sector, what it's like to work in the health and care sector, and an entry point into some of those starting jobs that Sharon mentioned earlier. And that's the intention behind it. And then as the programme progressed, we then added a fourth work stream, which is around job brokerage and involving the local authorities and their job brokerage services and others like Shaw Trust and other organisations that are working in this space, and how do they connect the people that they're working with all of those vacancies to make sure that there's a real connectivity between the demand and the supply side, and Sharon will talk more about that at the back end. In terms of the impact of that, and bearing in mind, as I say, we started some of these programs back in 2019. We've continued them through, and some of them were paused during the pandemic, and some of them just restarted very recently. But we've had a Careers and Opportunities Fair back in 2019, involving all the 6 colleges and 12 employers from the group. We are now looking at how we work with National Careers Service and looking at the virtual aspect of that. We've done some work in the construction sector, and how do we then replicate that across into this sector specifically. As I say, we've done the redesign of the curriculum, and that's rolled out since this September and will continue to roll out in future years. And we're now working very closely with Harrow and Uxbridge College, who are leading on the health T-level programme, and how we can incorporate the extended work placements into the work that the Education Partnership Group is doing. Sector-based work academies, as I say, we launched them pre-COVID. We've relaunched them post-COVID. We've just finished a programme the October just gone, and we're now following up on those learners and getting them into careers and job pathways within the health and care sector. So it's still a work in progress, very much so, and we are adapting and changing as we go according to the external environment. And that, I think, is one of the key benefits of the group, is that it has the ability to flex and change with the demands, both from the colleges and the work that the college is doing, and the different environment and landscape that colleges are in, and also from the employers themselves, and the very different landscape that the health and care sector is now in compared to a year and 18 months ago. So it is an evolving group, and it will continue to evolve, I'm sure, as we go through this, and different work streams will take priority over others. New ones will come and other ones will drop off. And I think that's really the benefit of working with colleagues like Sharon, is that we can have that open and honest discussion around, well, this has worked, let's do more of this. This hasn't worked, we need to change it. And I think that's really what I really have got out personally from that partnership. And I know the other colleges have as well. The fourth work stream I'll let Sharon talk more about, which is job brokerage. So I'll hand back to Sharon.
Thank you, David. So all of that is really exciting and in some ways quite groundbreaking work. And this is the bit for me which I'm most invested in some respects. This came out of, and I know this is the same for lots of my colleagues across North West London, this came out for me of having in 1 week phone calls from people like Mencap, from the Shaw Trust, from the Prince's Trust, and a couple of local authority job brokerage teams, and some schools looking for work experience placements. And my answer to all of them in some way or other was no, but thank you. And it was frustrating because all of those programs were incredibly interesting. They offered something really meaningful to the group, the clients that they worked with. And yet, as a large employer with a fully functioning and resourced recruitment team, we don't have problems recruiting people in to the organisation most of the time, and particularly at entry-level roles. Our challenge is in retaining and developing those people on. So what is it that we could do differently, was my thought, around working with those third sector organisations, working more closely with colleges to facilitate work experience rather than to block it, and with schools as well. And so out of that, sharing that frustration, came this idea around job brokerage. How would it be if we pulled together all of the people that were interested, because we all have the same intention in mind, which is to offer high quality jobs and outcomes to the people that we're working with. So how could we do that even more effectively if we work together? So the job brokerage came out of that. What we're asking our health and care employers to do is to ring fence some vacancies, entry level, and they go through the job brokerage. Now, it's not quite digital yet, that's the next bit. Job brokerage team work with their client group, identify people who are suitable, we'll do some work, if necessary, around numeracy and literacy. Again, do that matching to our values rather than skills and experience. Make sure that the person knows what they need to have in terms of documentation so that they're DBS ready. We had a vacancy last week for an apprentice, and we had almost 200 applications come through. And so it took 2 people 2.5 days each to go through all of those to shortlist. And we invited 10 people to interview, and 6 came along. 1 person was offered the job and 2 other are in reserve. So stage 3 is hugely beneficial to our managers, just in terms of the time that they would save through not having to do that shortlisting process, which the job brokerage service would offer. The selection process would be as usual, or it could be slightly different, and we would get the person onto our application system, NHS Jobs or Track or something else, at a later point in the process. But what it does is offer a way to connect in better, more effectively, much more personally with our local community. And I think as a large employer in North West London, that's something that we've not done well, and I'm really excited that the job brokerage service gives us a new and different way to get that engagement. Thank you. Anything to add, David?
No, thank you.
Back to you, Michael.
Well, thank you both, Sharon and David, and that was fantastic. And I particularly love, you know, where you've ended up as an example of building on your relationship, but also responding to that real urgency and immediacy of what different economies and communities are going through. I think there'll be real interest in the jobs brokerage system from outside of North West London, but I'm really particularly interested in following the journey of that, because I think that will almost hold up a mirror, won't it, to some of our existing practices, and really we will learn an awful lot from that. I think also the job brokerage element is a really interesting segue into colleagues from the Greater London Authority, the GLA. We know that skills and employment is a really intrinsic, important part of London's economic and social recovery. And so it's absolutely delighted to introduce Farouk and Michael from the GLA. And I'll hand over to Farouk Ramani first.
Great, thank you very much for that introduction, Michael. And great to be part of this event and follow colleagues in terms of what they've been outlining in terms of collaboration locally. So in terms of what we wanted to talk through today is just to give you an outline, an overview of the recovery programme for London, and in particular the focus around skills, employment. Clearly, obviously, since the pandemic hit us in the spring of this year, there's been a really disproportionate impact of the pandemic on certain groups of Londoners, and it's further exacerbated some of those kind of structural inequalities that we've seen in the capital and across the country. Obviously, this is really worrying. So a lot of effort has gone in across City Hall, London Government, working really closely with our stakeholders, including the FE sector, NHS, nationally and in London, to establish what are the areas that we really need to focus on to help those Londoners most in need. And as you can imagine, when we consulted with Londoners to determine these priorities, top of the list was obviously containing the virus, but second to that was protecting jobs. And I think this is where we're really keen to focus our conversation with you today. So one of the priorities of the recovery programme for London is supporting Londoners into good jobs with a focus on sectors that are going to be key to London's recovery. Now, clearly those sectors in London that we're looking to focus on are areas where we are seeing a good increase in job opportunities, job growth, but also where there's job creation, and that particularly lends itself well in terms of some of the sectors that are emerging, such as the green economy. But for the focus of today's discussion, we're obviously keen to focus on health and social care, which is a really important sector for London, and as we've heard, a huge employer nationally. In terms of how we look to do this, there's a real appetite to look at how we can better collaborate across the skills and employment systems, so working with our anchor institutions such as further education, the NHS, higher education, and employers across the piece to really support Londoners to access the skills that they need into the jobs of the future and now, and ways in which we can do that, for example, is around establishing more sectorally focused approaches, and hearing the example that we've just heard now is a really important opportunity for us to focus in on and see if that's the sort of thing that we should be doing more widely across the capital. So this idea of having these London academies essentially is around how City Hall can support institutions in terms of education, businesses working together to address those sectorally focused and occupationally focused skills needs. And obviously in doing that, we need to work much more closely with employers in particular. And again, it's not just, from our perspective, it's not just about accessing any job, it's about how do we ensure that Londoners can access good jobs and that we can really address some of those structural inequalities that we see in certain areas. So in terms of how we do that, we've set out an action plan, and apologies for the teeny tiny writing on this screen. The slides will be shared, but just to give you a sense of some of the things that we're doing at the moment to try and address the priority of this mission is doing some analysis, really understanding what those job opportunities are, where those occupations are, working with our partners to understand what's happening now, hearing about some of the good examples of where collaboration is working really well, how do we build and support that, doing some mapping across London, looking at where skills employment interventions currently exist, where the gaps are, who are the people that are falling through the cracks, how do we support those individuals, and how do we best align our funding streams, particularly our education budget, to better support these priority sectors. Other things that we'll be doing over the coming year is establishing opportunities for how we can promote good work. So Kickstart was mentioned as one of the schemes that government has nationally launched. This is obviously a really important opportunity for how young people can access work experience and hopefully progress into a positive outcome. For us, it's really important that whatever opportunity is offered to individuals, that it's a positive one, it's a good one, and we're really keen to work with employers, with intermediaries, to ensure that those offers are good offers. So there's some work underway to look at how do we create a good Kickstart guide, for instance, for London. And there's awareness raising. How do we make sure that Londoners are aware of the opportunities that are available to them and that they can do this through whichever route or whatever barriers they may have, that they have a clear offer and opportunity to access education, skills and employment support. And we're defining this as the access to a no wrong door approach. So no matter what route you take, it's not the wrong route, it's not a wrong door. And in the long term, essentially, we want to be able to have a much more integrated employment and skills system. That would be the ambition, working much more closely with employers and having really clear pathways for individuals to access. And in terms of measuring that success, obviously, we need to make sure that we've got a clear ambition that we can work towards, and that we have our partners, our stakeholders bought into that as well. I'll just hand over to my colleague Michael Heaney, who will talk a bit more specifically about some of our emerging thinking around health and social care and how we can try and develop a much more stronger focus on supporting the sector and supporting individuals to access opportunities in the sector. Over to you, Michael.
Thank you, Faru. I'm just moving the slide forward. Bear with me a moment, please. Sorry. Right, okay. I'm just, slides have leapt forward out of my control, sorry. Yes, so here we are. So I'm Michael Heaney. I am a Principal Policy Officer in the Skills team at City Hall. And we are the team that's responsible for the Good Work mission. And part of that mission, as Faru has explained, is around having a sectoral focus on areas of the economy where we know there's going to be growth or pressure. So we've actually made our initial thinking based around the work that went into what was called the Mayor's Construction Academy, which is an approach whereby we simply brought supply of training and skills into the same space as an employment sector with vacancies it needed to fill. We focused on construction. David, who spoke earlier, mentioned the work they're doing in this piece in West London. And it was on the basis of that work that we decided to expand that to look at some of the other sectors that we now need to focus on in recovery. The first job we have, of course, is to define those sectors. We've so far settled upon health and social care, on green skills, on creative, and on digital. I'm focusing on the health and social care aspect of that work. And we, of course, first of all, need to do, which is partly what today's about, is developing our evidence base as to why we would have a rationale for mayoral intervention in this space. In doing so, we are engaging with stakeholders. So today it's great to have so many people from the NHS and from the college sector, building on the strength of that report Michael mentioned at the beginning of the session. We will be consulting widely with stakeholders in forming that evidence base and building our narrative to take this work forward. I can just go to the next slide. Ooh. So here I'm giving you an example of what we did with construction. So this shows you that we were able to interrogate our own data sets and determine where the concentrations of skills training was in the construction sector in London at that time. This is data from 15-16, but it's purely for illustrative purposes. And as you can see, we knew there were greater concentrations of construction training in the east and again over in the northwest, but less so in southwest. So there were areas where we knew we had to sort of look more closely and make use of this data in helping us to shape our case for moving forward. We devised a series of hubs which were there to effectively coordinate that supply of training and with employers who had vacancies to fill. As I said earlier, we had one in West London, David referred to it. There are others, we've got them in North London. We've in a new second wave of applications to become a hub. We've now got them in formerly underrepresented areas of Newham and the South London partnership area. So again, for illustrative purposes, initial evidence gathering, and colleagues in the NHS have been very supportive in helping us to try and get our heads around the absolute wealth of data that exists in that particular sector. For example, we know there are 350 occupations within the NHS. Sharon mentioned earlier about its scale as a global employer, but yes, so 350 occupations in this sector alone. So using the knowledge that we, through the GLA and the devolved adult education budget as a starting point, we thought, well, which of the skills does that budget fund that contribute to some of these occupations within the NHS? So really just narrowing down, again, just for illustrative purposes, some of those occupations, entry-level occupations. I've just pulled out the healthcare assistant and support worker, and I can see there that there is a pan-London vacancy rate of 11% in that occupation. If I look more closely at one of the 5 geographical areas the NHS operates in within London, there's a difference though between that very post. That the vacancy rate in North London is 10 whole percentage points lower than it is in Southwest London, and we need to work locally with the respective stakeholders to get behind what the reasons might be for that and get a better understanding of what sort of an intervention we could make, if it's a skills intervention, that could make a difference in that space. So yes, that stark point I just made, that's one example of vacancy differentials within the London area that are quite stark. So I mentioned stakeholder engagement. What we're primarily doing in this across those 4 sectors I've set out is understanding what the challenges are. Sharon and David have both set out what you're doing and how you're approaching that in Northwest London, which is a great example that we can look more closely at to see whether that's a model that we could migrate across the other parts of London. What are those opportunities? You know, how can we use the learning we have in this area to better shape? David mentioned earlier about careers information and how crucial that is at the right time, that intervention. I'm curious as to where all these BTEC people are going, what progression outcomes and what destinations are they following instead of the one they thought they were on. And what support could a mayoral intervention bring? Is it specific types of provision funded through the AEB? Is it, for example, wraparound services? Is it coordination, as we saw was so valuable in the case of the construction sector? So what we will do through this evidence gathering is to build a really strong narrative as to why. We would really like to work with the sector to establish a set of key principles under which this work will operate, and agree together what are those outcomes that we want to get to make this have an impact in this very, very important work of London's recovery. Thank you for that, and I'll now hand back to Michael.
Thanks, Michael. I'm actually going to pick up from here, so because we're anxious to try and get a few questions in. So can I thank everybody for their contributions, really, really helpful, and particularly Faru and Michael for the last little bit, just giving us a clue as to where we can perhaps go to in terms of co-designing for the future, because we've obviously talked about some really valuable opportunities today, opportunities that have been accelerated by the opportunities that have come out of COVID. That means that we need to sort of work a lot faster. So one of the prizes that Sharon referred to earlier on was about the relationship with big employers, something that colleges have been tackling and working with for quite some time. And particularly that, I thought, a very honest reflection that she gave about having to reject a lot of colleges, other employers, other providers who make contact and try and say, we would like to use you, we would like to have placements in your organisation. So we've got one question to start us off, and can I invite other people to please do post your questions in the question bit if you want to raise them, because otherwise I'm going to ask mine instead, and that's a bit mean really. So do take the opportunity. We've still got 15 minutes, so take the opportunity to put something in there. But can I start with asking a question that's been posted about the first steps on building a relationship. So I'm going to ask if you don't mind turning your cameras on, Sharon and David, and perhaps through Michael as well in a moment, so that we can ask questions of everybody. But to start with, if you don't mind, Sharon, if I start off by asking you, there's a question being posed about the first step in building a relationship between the NHS and colleges. You've given us some clues already, but that just like, where do you start?
That was quite hard for me. And what made it really easy was the intervention of our local CCG group, who were interested in greater cross-working, systems working, collaboration. So I had a link in to people like David, which left to my own devices probably would have been quite hard to find who was the best person to talk to. So I think some kind of collective systems working has made it much easier to achieve. My learning from this is, I think, start at the top. So it's great working with the people who make the phone calls, but they're often not the decision makers. So a lot of good work can go a long way, but then no further, because actually we're working with the wrong people.
Yeah, that's helpful. And David, I think you made the same comment actually about the importance of sort of strategic buy-in right from the start.
I think that's absolutely critical. Is have that support at the senior level from both sides. And you know, I remember, you know, we presented this to some senior colleagues from the NHS trusts as well. So, but from a college point of view, yes, having that buy-in at the very top and building it into your strategies, your college strategies for employer engagement and work is really crucial, because you know we appreciate people move on from institutions, and you know this can't rest and fall on individual relationships. Although that's great to make things happen, it needs to be more systemic than that, and to have longevity, it needs to be part and parcel of the culture of the organisations to have these working relationships. And I think it's what really sold it to myself and colleagues from the college was we could see the mutual benefits of this. This wasn't something that was just going to benefit the employers or just benefit the colleges. This was definitely something that was mutually beneficial. You know, we would be supporting our learners to get into real sustainable jobs and destinations, and the employers would be solving an issue around vacancies and career pathways. So that mutual benefit is really important to really sell that on both sides, I think.
That's really helpful. And I mean, obviously you do a huge amount of work with all sorts of employers, as do lots of the colleges and providers who are part of this today's webinar. What's the difference, do you think, you know, in simple terms, the difference between working with, you know, a different employer in your area, still large, but and working with NHS? Are there any particular things that you need to do or be aware of?
Yeah, I mean there are, and as Michael said, you know, we've learned a lot from the Mayor's Construction Academy, because there are lots of similarities around how you engage, particularly the you know, the smaller employers that are involved in the sector. And the NHS has, health and care sector has smaller employers as well as the large trusts. I think for me the learning curve personally was the complexities of the NHS trusts and how they're structured, and the different way in which they're organised and structured. That's certainly something that I wasn't aware of prior to this, and I wouldn't confess I'm a complete expert at it now, but I'm understanding how these things fit together with the ISGs and the trusts and CCGs and everything, you know, everything else that sort of connects with this sector as well. And I think that's important to have that understanding.
Yeah, yes, I certainly appreciate that. I think that's professional respect about somebody's organisation and how their decision-making works is something that you would afford to any employer, and yes, NHS needs to be part of that. So we've got another couple of questions, one of which is directed to Michael. So Michael, I wonder if you'd mind joining us with your camera on so that I can ask something of you. And that's two questions actually I've got. One which is about when we think that the Mayor might make a decision on the sort of future interventions that Faru outlined, and you provided some more detail on. Any idea what the time frame is that we're talking about?
I think we'll be looking at having a clearer direction of travel on that this side of Christmas, certainly. I think if anything is going to affect the actual funding of provision, that would be a slightly longer window, because that will require slightly more permissions to go through. But certainly this side of Christmas, we're hoping to have really sharpen that narrative across the 4 sectors I mentioned, in particular health and social care, with which we're making great progress at the moment.
That's helpful. And the second one, and I was acutely aware of this when we were doing the planning for this event, we picked on North West London because David and Sharon and colleagues were very happy to share sort of their learning from the North West Health and Social Care Partnership, sorry, Health and Care Partnership. But we're also conscious that there were and are other practice elsewhere, and we got a message from Nikki saying, of course, there's the Islington Health and Care Academy, who work at a senior level, and they're very interested in being part of the journey. We're also conscious, and Michael, I know you've spoken about what's the Care Academy elsewhere, Care City. There's bits of practice of work going on in Croydon, so there is practice across London. How do other partners like that become part of this journey, the co-designing journey that you've referred to?
Well, I'm finding out lots of these myself through my own travels, but I'd be very, very keen for anybody who's working in this space to make direct contact with me, to feed directly into that work. Yes, we have, Care City is a good example. There's similar work going on in many different parts of London, and different ways of approaching it too. This is very important. So yes, please, I think the organisers will be able to share my contact details after this session. Please get in touch.
Super, that's really helpful. I think that's what we were hoping would trigger, is actually examples of practice, because nobody's being very precious about saying they've got the perfect way, but we certainly need to sort of get everybody involved. I mean, I'm very conscious of the fact that we've got a great group here today in terms of both local authorities, colleges, other providers, voluntary and community sector, and NHS colleagues. So everybody's got an interest in being part of this journey. It's how best to do it. We've got another question from Sahel, who's asked that about how, when you do get, she's saying that we're currently involved with Health Education England, providing online functional skills courses for existing staff, Sharon. But people find it challenging to commit to a course and get released from work. So there's a reluctance to get involved. I don't know whether you're able to add anything in terms of how you're able to accommodate that, or David, how your provision has been able to sort of be flexible to supporting people.
Shall I go first?
Start with Sharon, sorry, yes.
It's a challenge, and I think it will continue to be a challenge. There's something about, I think, online provision for lots of people works really well. We have taken an approach where there is a classroom delivery as well as an online option, and actually a blended approach. So we're trying to cover people's preferences for learning styles, and also how this is going to work best for them as a busy working adult, fitting it in around work time. Being often a healthcare support worker is not the job where you can put on your out of office and go and study. There are patients who require care. So our approach is, the individual is motivated to do this because often it means that will enable them to get onto either a nursing associate or registered nurse apprenticeship programme, which for that individual is huge. It's pretty big for the organisation as well. So it's something about, there's a clear purpose for why the person's doing it, and we can all see the benefits in supporting that person to be successful. And I think once you've got that purpose clear, then the difficulties and the challenges around making their shift pattern work with study doesn't become easy, but it becomes a bit less challenging.
David, did you want to add to that?
this is something that has cropped up at the meetings, and I mentioned the 4 work streams. There are a few other issues that are sort of bubbling around, and this has been one of them around that provision of functional skills, English and maths. And we haven't cracked it, as Sharon said. It's a trial and error sort of thing in terms of what works and what doesn't work. And I think the benefit of being in a collaborative partnership is that you've got opportunities to broaden that risk, if you like, in terms of trying different approaches, 100% online, blended, classroom, employer-based, college-based. You can try lots of different things and see what works best. And as Sharon said, different things will work better for different individuals and different employers. But I think that is one of the key benefits of being in a collaborative partnership, is that you can do different things and have that broader capacity and resource to try that out. We've also got some innovation funding from the GLA as well, which allows us to be a little bit more flexible around how we can fund and provide some of these skills.
Thanks, David. That's a perfect in, because I'd be sacked as a question and answer person if I didn't raise the issue of money. So I'm going to invite both Faru and Michael to turn their cameras on again, because one of the questions which people are sure to ask is how we actually get any resources, either from the Mayor or Michael from NHS London. Where will the resources come from to provide anything that actually helps facilitate this process? And then, just to give you warning so that you've got a chance to think about it, if you wanted to recommend one thing for investment that would actually make the difference to the partnership that you've been running, David and Sharon, could you just tell me in a minute what that would be? So I'll give you time to think about it. But let's start with Michael, because Michael Wood thought he was going to escape and not get asked the question. You can have any money behind you, Michael, for any of this.
What I think is really interesting is what we've heard today is a real collective voice. So it's not just a case of what does the NHS need, it's not just a case of what the colleges need, it's not just a case of what the GLA do. And I think the more we can construct that sort of place need and place solution, the more chance we have of coming together. And what really interesting is how we can solve some of the burning challenges. So one question would be, if the jobs brokerage system we've just had explained in North West London can support with the vaccine rollout and the recruitment for issues like that, I think you will see a real interest from partners, particularly the NHS, in investing in things like this. So I think there's that multi-agency place approach, which ticks lots of boxes and agendas, and then narrowing down on some real current issues where we know we will have to resource to get some solutions. So I think that, for me, that's the sweet spot. And I think today is an example of where we are nearing that sweet spot from a few different ways. And I would hope that we can resource as appropriate this.
Lovely. Faru, could you add to that?
Yeah, sure. Thank you, Mary. I mean, in terms of resources, I mean, there's a huge commitment from City Hall to support this agenda. They're really committed to this. Obviously, our main funding stream, our revenue funding stream, is the adult education budget. And I think, our steer will be to providers that, there needs to be much more focus on supporting those sectors that are going to be critical to London's recovery. Health and social care is so important as part of that. We've made a number of flexibilities this year, in particular, to allow our providers to at least provide more level 3 qualifications. There's certainly exploration around what more we can do, and we'll continue to consult with our providers to determine that. It's likely that any kind of underspends that we have, we may use to commission some very focused, sectorally specific programs. Again, health and social care will be core to that, and that's likely to launch in the new year. And then further to that, we are exploring additional options to bring revenue funding in from outside of the adult education budget to support collaboration, network development, and so on, to help support and build on this. But I think what we really want to explore is how do we work better together with our partners to bring together our resources and strengthen what we do, and really kind of try and join up as much as possible, because the reality is I don't think City Hall alone is going to be able to address this issue, that's for sure. but we're keen to obviously continue working with our partners on it to bring our funds together as much as possible.
Yeah, I think that's a single message we've definitely heard today about the benefits of collaboration. David, over to you for a 30-second, what would really help?
Yeah, I mean, again, going back to sort of parallels of the Mayor's Construction Academy, obviously that was funded through a coordinator post of revenue, and that has really made the difference in terms of the success of that, having that post in place to bring those partners together, both from the provider sector to the employer sector. So that would be my ask, if you like.
Thank you. And Sharon, you spoke quite passionately about the job brokerage, but is it that, or would it be something different?
It's that and something different, I think. I think for job brokerage to be successful, for it really to be accepted by our resourcing teams and managers, it has to be digital. It has to be as easy to use as NHS jobs to post a vacancy, for example. If it's lots of paper, it just won't get very far. So I think there's investment there on the technology. And I think the other part of acceptance, managing those challenges, is there is some suspicion, concern that where things like skills programs, the care certificate are delivered outside, it may be less than we could do ourselves. So how would it be to have people embedded in the organisations, or some cross-working where our practice educators go out into colleges and other providers to deliver that, so we work together much more closely in a practical way.
Thank you for that. That's a brilliant way. It's also a brilliant way to end our webinar, because actually it goes to the heart of working collaboratively in order to gain the better benefits, which I think is what the purpose of today was all about. So can I just end by thanking everybody, Sharon, David, Michael, Faru and Michael for organising this in the first place, to reassure everybody that we will be sending out these slides, so they will include email addresses, and to reiterate Michael's invitation, Michael Keanew's invitation, to say if you have got practice, if you're involved in practice at the moment, please do tell him, because he is gathering that at the moment. And I think it's fair to say, warts and all is fine. We need to learn about what's going on so that we can do the best for our area. So thank you to everybody who's been involved, and do please stay in touch and share. Thank you very much.
Thank you.
Thank you.